Welcome to Business Innovators Radio, featuring industry influencers and trendsetters sharing proven strategies to help you build a better life right now.
Hello and welcome to today's show here on Business Innovators Radio. My name is Tim Dimmick and will be the host of today's show as we take on just a small segment of the huge topic of healthcare. The segment we're going to be discussing today is focused around the high deductible healthcare plans and copays and your choice when it comes time that you need to use that insurance. As we settle into these enormous changes that have been taking place from the implementation of the Affordable Health Care Act, many of us on a personal level are witnessing our premiums increasing for some time now. We're also finding ourselves having to choose higher deductible plans because of these premium increases. I might note that if you get your insurance through your employer as well, that you're facing the same thing as well as they're facing the same thing. They're choosing higher deductible plans to manage their costs as well. But either way, there's a growing number of people with these higher deductible plans and copay plans. That being said, we want to talk about the importance of knowing what your choices are with these plans when it comes time for the medical care. And with us to discuss this topic is Linda Stanley. Linda is an occupational therapist and a certified hand therapist and has her own private practice called the Institute for Hand and Upper Extremity Rehabilitation. She's got locations in Doylestown, Quakertown, as well as the Allentown, Pennsylvania area. Welcome, Linda.
Good morning, Tim. Thanks for having me.
You're quite welcome. We're excited to have you. So, Linda, having your own practice, being right in the middle of the healthcare arena, I'm really interested in getting your perspective on how these increased copay and high deductible plans are affecting not only the consumer, but private practices like yours. In doing so, let's first discuss the difference in cost basis on the facility you choose for your treatment and how that plays into the high deductible programs. And for today's conversation, let's use your facility as an example. Somebody has an accident, maybe they have an operation, now they need therapy. What's the typical chain of events that occur in a scenario like this, and what is it that the patients need to be aware of?
Well, I'm an occupational therapist and hand therapist, and the majority of patients that we treat are patients who have shoulder, elbow, hand, and wrist injuries, and these are common either in the workplace, home, or auto accidents. So there are quite a good amount of people who do have injuries like this, and then they are faced with the challenge of where to go after an injury. And often after an injury, you're not even thinking about a choice. And it really is important for people to know that they do have a choice in where they are going for their therapy and other health care needs. But what typically would happen is you see the physician says, okay, it's time for you to start some therapy. And a physician may or may not make a suggestion on where to go. They may say, find a therapist of your own. And then you can kind of get on the internet and, like everybody else, and try to find where would be the best place for you to go. Or you may choose to just go to the hospital because you know the hospital offers this kind of services. But the physician may also make a recommendation on where to go. And oftentimes physicians that are hired by hospitals, which is often the case now is with healthcare and physicians having their own challenges, they're being bought by hospitals. So hospitals expect their physicians to refer within the hospital network so that they're keeping all of the services and the costs and their revenue internal. So if you're told to go somewhere, you really do have a choice. And that's the important part, is knowing what your insurance is. And that's the other thing about having an injury or a trauma. You don't always understand what your insurance is until that happens. And those are the patients that we face. And so they just end up making a choice that isn't educated, or they're not doing any research about. And, you know, you would shop around for a car, you would shop around for your groceries and use your coupons or whatever. We shop around for cost of things, but we're not always shopping for our healthcare costs. Now, people are looking at their premiums, as you mentioned. Employers are offering different plans, and people are getting health care on their own. So they're looking at the cost of the premium, but what they need to really look at is the cost of the service itself. And you mentioned high deductible plans. If you have a high deductible plan, many people have $4,000, $5,000, $6,000 deductibles. What that means is, until that deductible is met, the insurance company isn't paying a dime. It's all on the consumer, who is the patient, for me. So if you have a $4,000 deductible, and maybe you didn't have surgery, maybe you just had an injury, and maybe you had a fracture and it was taken care of with no surgery, you haven't met that $4,000 or $5,000 deductible.
Mm-hmm.
So coming to see me in a small office, a private office, the reimbursement rates from the insurance company or the allowable amounts are much less. It could be 20% of what the hospital gets for that patient. So, for example, there's a hospital that charges $800 for an evaluation in our area. And that's about $600 is allowed by the insurance company, which means that if you have a deductible, that's what you would pay the hospital, $600 for an hour evaluation with a therapist. In my office, that would range anywhere from probably around $90 to $110 for an evaluation. Wow. And treatments, ongoing treatment is the same thing. That's a significant difference. Most people cannot afford that, and nor is the value there for them.
So a lot of people, what you're saying, Linda, is a lot of people, they're taking their doctor's word for it, or wherever that initial occurrence happens and who they go see, which obviously it's going to be their family doctor or obviously the emergency room in most cases. They're going to typically take the advice.
Orthopedic doctors. Yeah, they'll follow up with orthopedic doctors, things like that, whoever sees them for the trauma. But yeah, the doctor tells them where to go. They're going to take their advice because people trust their doctors, as they should.
Right.
But they have to understand the motivation behind the physician's referral.
Why is it that these fees vary so much between a private practice like yourself and, a medical facility, like a hospital or, one of these big medical conglomerates? Why is there such a really difference?
Good question. And I had to ask myself that for a month, and I really had a hard time trying to figure out why. Why would the insurance companies be so willing to reimburse the hospitals at such high rates compared to us private practices where it's so small? But if you look at what drives the whole industry, the hospitals are where the patients are going to go. Mm-hmm. They go to the emergency room, they go there for surgery, they go there for x-ray services, all kinds of ancillary services, right? So that's where you would go for that. So therefore the insurance companies have to contract with that hospital because they obviously have to appeal to their customer. So you, the consumer, is going to pick your insurance company based on where your insurance company is accepted, right? Mm-hmm. So the hospitals kind of hold that leverage a little bit with the insurance companies. They hold a lot of leverage there because the insurance companies need the hospitals. But us, we're small. We need the insurance companies. The insurance companies don't need us so much because the patients can already get taken care of. But we as small providers need to be able to appeal to our patients. So we need to say, yes, we are in network. Yes, we accept your insurance. So therefore, the insurance company has leverage over us. Okay. But the problem is long term. If you think about this, many private practices are going out of business. Many people are experiencing their doctors being bought by big hospital practices.
I was just going to ask you about that.
Those doctors' offices are experiencing the same thing. You go to the doctor, and now all of a sudden they're owned by the hospital, and that doctor's office visit that used to cost you $80 now is $250 because they're hospital-based. And so what happens long term, if you think about this, the hospitals are getting business, right? The doctors are feeding them, and they're getting the business. And then, so I know 3 private practitioners in the last 6 months that have sold their practices because they are not able to, 1, operate with the lower reimbursement rates that we're getting, and 2, not getting the business because the patients are getting sent to the hospitals more than the private practices now. But if we, as smaller businesses and lower fees, eventually go away, and we don't exist anymore, right, then there is no affordability to healthcare, is there? Because now the hospitals will have all of the leverage because they will be the only providers. Exactly. Right. It will basically be like a monopoly. And that's kind of scary when you think about it, because right now we're the only affordable option. And hopefully, my hope is that the more consumers are educated and they understand they have a choice, and they do start actually shopping around where to go. First of all, they'll find that the private practices are owned by very experienced therapists. I have 2 therapists working for me, both over 30 years of experience. I have over 33 years of experience. The hospital will hire new graduates. So who would you rather be treated by, the experienced therapist or the new grad? So you're getting more bang for your buck too,
yeah,
you know?
and I really believe that. I think most people that have ever experienced, a private practice, somebody like yourself that's got a lot of experience would rather be there. And I think they feel they get much more personable service from someone that runs a private practice versus walking into these big, medical establishments where, I've been there, you sit there on the table, you wait half an hour for the doctor to show up. They're there
Right.
15, 20 minutes. They're reading stuff off the chart. Boom, you're out the door. And it's, there's no.
So you bring up a really, really good point. Well, what happens with the physicians now that they're owned by health networks and hospitals is they are being monitored by the hospital on how many visits they see. So they're expected to see one patient every 6 or 8 minutes, whatever the guideline is by the hospital. But I've heard this. I hear this complaint by physicians. Many physicians struggle to stay in private practice. Physicians are retiring because they don't want to be owned by a hospital. The local physician here moved down and decided to be an educator as opposed to maintain his practice. You're seeing large changes in healthcare. And I think that, fortunately there's more and more in the media about it, and hopefully then that will kind of play itself out. But.
Right. So listen, folks, I'm hoping you're hearing this. Follow the money. This is one of the reasons that our insurance premiums are shooting through the roof. These insurance companies are paying, double and triple the amounts for the same type of services that you can get in these private practices, and they're paying these amounts to these hospitals and big medical associations versus the private practices. And if Linda, you made a great point. It's almost inevitable that these private practices are getting swallowed up, and at some point in the near future, probably you're going to disappear unless people start waking up to the choice that they have and choosing to support these private practices while saving money at the same time.
Right, and that is really the biggest message I'm trying to get out there, is just that people just need to be educated and know what they're actually getting. Know that they have the choice. I fortunately do see more people looking things up on the internet, looking at reviews of their providers, trying to get to know really what their choices are.
The next thing I want to hit on is, the in-network and out-of-network thing. I think it may have been a bigger issue previously. I know when my wife's employer changes insurance and, that you had to always check, was your doctor in network? Were they not in network now with a new insurer? Tell us how that's playing into, or how that plays into these higher deductible plans. Is it something that you still need to be, so concerned about? Or are there more people that are in network or cover? What's the difference between the network for the insurance company and the network for the doctor? Because I think that's a very confusing point as well.
Yeah, the word network is kind of it's a large term used in many different ways. And so when you talk about a healthcare network, you may have, and that's what's happening, larger and larger hospital systems are taking place. Larger hospitals are buying and partnering, merging together with other hospitals. So they create a network of hospitals in order to service a larger region. So that happens. That's happening a lot. The city hospitals are kind of migrating out into the suburbs, and so they are a healthcare network. So that's the healthcare network, the hospital system. And that's what I was referring to when I was talking about physicians referring to their own network and the hospital network expecting the physicians to kind of refer. And they actually bonus their doctors based on that, which I think is really a questionable way to bonus your doctors and your employees. But then there's the healthcare network, which is, and the terms in-network and out-of-network. Yes, in-network and out-of-network service providers. Is your doctor in-network? Now, the majority of providers, at least in my type of business with therapy, are in-network with most of the major, healthcare insurers, such as Aetna, United Healthcare, Medicare, Blue Cross Blue Shield. So I participate in all of those major ones. We accept workers' compensation, we accept auto insurance, things like that. But the in and out of network for insurance companies are in-network providers. So those providers agree, I have a contract with the insurance company, and that makes me in-network. And that's what allows them to say, this is what we're going to pay you. So there's an allowable amount that the insurance company decides that I'm going to get. Doesn't matter if I charge $5,000. I'm only going to get what the insurance company says I'm going to get.
Right.
And that's what gets passed on to you as in your deductible. So it's not what I charge, it is what the allowable amount is for an in-network provider. Now, an out-of-network provider is different in that regard. If you participate with an out-of-network provider, you're going to have a separate deductible usually. And they can kind of charge what they want because they don't have a contract with the insurance carrier. So you may it will go towards your out-of-network deductible, and you can eventually get some reimbursement for that after that deductible's met. But those are usually higher than your in-network deductibles too. And that's the thing. With in-network, it goes on the allowable amount, so people have to be aware of that too. And the facilities, though, sometimes add these facility charges. I know they do this for MRIs. I'm not sure they do it for therapy or not, but you do an MRI and a in-network provider, they can still charge a facility fee, which for MRIs can be another $600.
Yeah. While you're on that point, Linda, I want to bring up that my wife was in a car accident and went to the hospital, and of course the lady that hit her, her insurance paid everything. But when we went to file the claim with this insurance company, and they told us that we had to get all these doctor bills, and they made us aware that we're not going to get one bill from the hospital. We're going to get 4 or 5 bills. It was, one from the doctor, one from for the actual service, one for the hospital space or whatever. I forget the facility. I guess they called it a facility fee, doctor fee, the equipment fee. And it was like, we submitted the claim and they said, all right, we're closing the claim. We found out there were still 2 more outstanding bills. So when you look at something like that, and then you look at the facility that maybe does, an MRI facility, standalone facility, you go in there and pay a fee. That one fee covers everything versus you go to the hospital, you're paying 5 different fees. Right, and that is actually an interesting point. There's a MRI center that I've been communicating with, and their whole fee is, I think it's $650 or something like that, which is all inclusive of the MRI and the reading. And the hospital fee is like $13 plus a $600 fee, and so when you're talking about a deductible, that's a really significant difference too. Yeah. That's your out-of-pocket costs and expenses, and some of the insurance carriers are putting up their fees on some of the local hospitals. So you can do a cost comparison on your insurance company's website, which is kind of interesting. But they're still not including us private practices. They only have the major hospital networks to compare to. But MRI is another thing. There's not a lot of independent MRIs anymore, but definitely you'll save money if you go to them. Right. And again, it comes back to the in-network, out-of-network. It comes to the referral thing, I guess, is really what I want to say, and where your initial consultation happens. And just coming back to that in-network and out-of-network thing, folks, I just want you to understand it. I think, again, it's very confusing. Your doctor may be saying, this person is not in network or they're out of our network, and that may be the facility, not the insurer. And as long as the place you choose to have your treatment at is covered by your insurance covers it, that's the important thing. Yeah, it's participating providers, what you're looking for, a participating provider. And call the insurance company and ask that, because oftentimes I know what happens with us is that they'll take care of, to keep it in their loop, they'll take care of scheduling your appointment. Oh, you've got a scheduled appointment for therapy for next Tuesday at 3 o'clock. There you go. And you think you're all set and you're doing great, but that's kind of a sneaky way to not offer choice. Right. And I personally don't like that. I think that I want to make my own choices. I don't think somebody should be making them for me. Right. Lastly, Linda, I'd really like to come back to the subject of, the private practice versus, the big organizations, the hospitals and so forth. And, tell me what the difference is for, maybe we got some listeners out there that haven't really experienced the difference. What's the difference of going to a private practice? How much more attention do they get? How much more personable is it? Tell me what your experience has been for your clients. Well, I think for me, I'm vested. My name's on the door, and it's not just a job for me. It's what I do, and it's what I am. And I think that most of the therapists that I know that own private practices have the same
feeling. So, I wake up in the middle of the night thinking about my patients because I do care about them. And I think that they get a true connection with me. And there's good therapists in health and hospitals and stuff too. It's just that you don't know what you're getting and you don't know the experience level of the therapist. And you don't always get the therapist or provider. You may start out with a therapist and then you may be passed on to an assistant to be treated. That happens in larger kind of corporate practices as well often. And that's to contain costs, obviously. It's a little bit cheaper to have an assistant treat you than the therapist all the time. But in my office, you get continuity of care. All our practices, you're seeing pretty much the same provider every time. And I think that helps a lot with continuity of care. Now, the nice thing is there's a couple of us that we can, kind of compare ideas if we need a little help with something or something that's challenging. But we have a great relationship with the physicians. And I just think for the patient experience, it's really important. The way that was really important to me in my practice setting is to offer a very comfortable, relaxing, and positive patient experience. I want them to be relaxed. I don't want them walking in being afraid that they're going to get hurt. And I take that to heart because it is my practice. And right. I think in the hospitals, I worked in the hospital when I started out, and I learned a lot there. But it's very different going to work for a 9-to-5 job than it is when you own it.
Sure. Well, listen, we gave out a lot of great information today. We unfortunately are out of time and need to wrap this up, but we can go on and on about this subject, I'm sure. But Linda, listen, in closing, I'd like to ask you to share your contact information. If anybody out there would have interest in reaching out to you and you'd be open to that, how could they reach out to you?
Sure. Our website is handinstitute.com, and the email address is handinstitute.pa@gmail.com. And feel free to give me a call at the office number at 215-348-9549. I'll be happy to talk to anybody, or if they have questions about, any injuries or physician recommendations, things like that. We're also willing to help out with that kind of thing.
Fantastic. Linda, I appreciate you taking the time out of your incredibly busy schedule. I know you're getting, your Allentown office up and running at the moment, and I know you're super busy, but I certainly appreciate your sharing your knowledge and your expertise on this subject. I'm sure, we've enlightened many of the listeners, and again, thank you for your time.
Great. Thanks so much for having me.
Great. With that, we'll be signing off till next time. Thanks for listening to Business Innovators Radio.
Thanks for listening to Business Innovators Radio. To hear all episodes featuring leading industry influencers and trendsetters, visit us online at businessinnovatorsradio.com today.